Outlook was arrived at his house at a typical long Friday for lunch break. He went to eat at Lucky's Baldwin's, and he had a traditional 2 pint of gonas and beer and chips. He's an engineer and works at Parsons Engineering in Pasadena. He felt dizzy with a headache and nausea. He went to the restroom and he leaned against the wall, and a colleague noticed that he had a speech impairment. A friend gave him a chair, and he lost control of his bladder problems and passed out. The ambulance was called and he was brought to Huntington Memorial Hospital. They called me and I gave information to a nurse. My husband was 48 years old. He's always lately been tired. He has some sexual dysfunction, so for a few years he went to Tijuana and has some fight everywhere. He seems to have, he's hard to read. He has blurred vision. Has always been hungry and thirsty, so he's been having a night snack in the middle of midnight. He drinks 6 packs of beer a day. He also has a frequent urination, half along at times, and he had a small heart attack that recovers in 6 months prior due to stress.
Hi, my name is Kenneth Lynn, and my patient is off-block. Due to the lack of evidence that I have received, I was not able to find out what my patient was going through or what he had. As I got his blood test and his urine test, I found out that his blood pressure was normal, but as I looked into his urine test, I found out that his glucose level was very high. Due to his glucose level being so high, it led to gum inflammation and toe infection, which is a result of less hemoglobin, which clots your blood and it does not expedite your healing process. And I also found out that he had a urine problem. The nature of a diabetic patient is that he has uretile dysfunction, urinary incontinence, dizziness, speech impairment. He had a high increase of thirst, high increase of hunger, and he also had nausea. And as I sat down and talked to his wife, all the evidence that she gave me matched, and it gave me the idea that he was a diabetic patient.
Hi, my name is Deshaun and I'm one of our block's doctors. He came to us a few days ago due to certain complications, and as we got his results, what is conclusive was that he was diabetic. One of the main reasons that he became diabetic as time passed by was his unhealthy habits of eating as well as drinking. The diabetic patient, for starters, should not consume beer in large amounts or at all, because it actually contributes to hypoglycemic. What happens is that your blood sugar drops unsafely, and that could actually be very fatal. Along with that, it actually also helps with weight gain. Speaking of weight gain, it also is related to food, his diet. He contributes a large amount of greasy food, which are lipids, and also carbs on the other side. What needs to be done on the other side is that he needs to stop consuming a large amounts of food and follow a diet with a certain amount of calories taken into consideration. What I recommended on block was that to have, for starters, about 2,500 calories, and to work yourself down for about 2,000 calories. What happens after that is that his physical activity level should be increased, and his caloric intake should be controlled, his carbs should be controlled, as well as his lipids. When that happens and you consume 2,000 calories, and if you burn 2,500 calories, what happens is that there's a caloric deficit of 500, and that actually will help him lose weight. The more he loses weight, helps him with his blood pressure level, and also helps him maintain his blood sugar. Along with that, he'll have a safe lifestyle. His diet will change and he'll live much longer. And that is what our blood needs, because the point that he has got right now is very critical, and I hope him all the best.
My name is Abba. 5 years ago, I was diagnosed with diabetes. My drinking habits were not normal, and I used to eat unhealthy food. After my life-changing experiences, I became a healthier person. Now I consume the appropriate portion per meal, and I've changed my drinking habits. Now I lost 60 pounds and I have a better relationship with my wife. I'm looking forward for a better life thanks to Dr. Lin and Dr. Parrish.